the Prime Minister is gambling with the health of thousands of people. We just can't be confident about which way this is going to go over the next few weeks. So we have to be very careful. And I think it's really potentially reckless what the Prime Minister's been proposing over the last week or two and what is likely to come this week. Any government at the moment would be having to steer a path between the economy and public health. But I'm afraid we went into this late, and the actions that were taken were too little too late or too much too late. And then now we're trying to come out of it before we're really confident about where we are. This is the problem. Yes, we can see the number of cases has been going down steadily. The number of deaths has been coming down steadily, but there's still over 1,000 new cases every day. And that's more than there were at the beginning of March, when we were really beginning to worry about it, and when the numbers of cases was doubling every 2 or 3 days. And to stop it doing that again, we need to be sure that the testing and tracing and isolating is robust. And I don't think it is. This is the problem. My intelligence is that what's preventing us doing the testing on the scale that we need, apart from the shortage of manpower, if you like, in the local public health departments and the poor performance by the private sector contractors, Deloitte and Serco, is that we haven't got sufficient reagents for the tests. So, this is the country that left the European Union at the end of January to take on the world. And 4 months later, it still can't produce enough reagents to do enough tests to keep the population safe. So, until we can do that, we're really got to be very careful. I just saw that there were more new cases globally yesterday than on any day since the whole thing started. We know it's an horrendous situation in Latin America, particularly Brazil, in India and Pakistan, that it's been coming back in China, even in New Zealand and Australia, and in Germany, and to some extent in France. We've had, over the last few days, a spate of outbreaks in meat handling places and abattoirs across the country. And, that puts the spotlight on high-risk work environments for whatever reason. I mean, the speculation has been that in abattoirs and meat handling places, it's a very cold environment, which favors the virus. It's difficult for the workers to be personally protected because of the nature of the work. And then because it's a noisy environment, they tend to be shouting across the room and maybe projecting an aerosol with the virus in if they're infected. So, that's another example where workers in that kind of setting should be being regularly tested, probably every week, as well as being really hot on the hygiene and personal behavior and all of that. So, we can't let our guard down. So when it comes to this whole thing about should we go down from 2 meters to 1 meter, I think it's reckless. I think it's too early. And we wait to hear what the Prime Minister is going to propose in the next day or two. A skeptic might say that the whole Dominic Cummings thing was deliberate, because when Dominic Cummings broke the rules and went to Durham, it undermined the whole trust in the social pact that there was about everybody staying at home and isolating and social distancing and everything. It's all gone downhill since then. I mean, we've seen raves in the big cities with large numbers of young people gathering together. We've seen lots of pictures of people not doing the social distancing, that there seems to be now an orchestrated campaign to get the pubs and restaurants back open when it's almost certainly too early. I'm afraid it's very worrying. I mean, don't get me wrong, we might get away with it. We might, but nobody can be certain that we'll get away with it. And if we don't get away with it, then it could be a terrible situation that unfolds over the summer or after the summer, because the virus will continue to circulate, maybe at a low level or a lower level through the summer period. And then when we get to the cold period again, when we come to October, November, then we could well be looking at this second wave, which has been much talked about. Independent SAGE seems to be on the same page as official SAGE in being opposed to reducing the distance from 2 metres to 1 metre. But the government now, having made great play early on about following the science, has decided not to listen to its own advisors and go and find some other advice that fits in with what they really want to do. So this, as I've talked about before, is politically led science, not science-led political decision-making. And when you think about what that means, what 1 metre means, as opposed to 2 metres, in the cafes and restaurants and dining places and pubs that everyone's familiar with, as it is, restaurants pack people in. One table, just a few inches from the next table, you've got your chair. By the time you've got your body in and your legs between you and the table and person opposite you, you're looking at a metre, and then you're looking at a metre with that table next to you that's quite close up. It's very close up, 1 metre. And it really doesn't bode well. You know, it's interesting how over the last few weeks, the whole discussion about masks has been turned on its head. You know, that before there's no evidence for masks, it doesn't prove, it's not worth it, it's a waste of time, it might make matters worse. Now, in order to be able to sell this 1 metre distance instead of 2, suddenly masks are definitely the thing that should happen. Although again, what we have here is the government not being willing to make that decision and say, yes, you've got to do it. And that's the same as has happened throughout all this emergency, is the government has outsourced responsibility. It's not been willing to take the responsibility for the decisions, so that if it goes wrong, it can now blame the public for not doing the right thing, the common sense thing, as the Prime Minister would say. To keep the public on board, it really was vital from the very beginning to be open and transparent, not least with the numbers. And what we've seen with the numbers has been real confusion all the way through. First of all, about only counting hospital deaths, not embracing the excess deaths total as was proposed by The Economist magazine. And, you know, this sense in which it looked as though they were trying to keep the number of deaths down at under the 20,000 that the chief scientist had said would be a good result. And then, of course, it crept over the 20,000. But there's a feeling that there was a desire to keep the reported numbers of daily deaths at under the 1,000 mark, which is what it topped in early April when it went up to about 1,400 deaths a day. But all that was reported to the British people was around 900, keeping it underneath the limit. The highly respected and former World Health Organization director Anthony Costello has said that it's time for Matt Hancock to go. Anybody looking objectively at the abysmal performance of the ministers who've been involved with this emergency, and also many of the advisors who've been involved, would say we really have needed a new team for a long time. The emergence of the independent SAGE has been a very refreshing move, because they've been very clear about their analysis, very clear about their reports and their communications. But really, if we're going to be able to reassert trust and confidence with the general public, there needs to be a new team running the show as we go through the summer, because we don't know what's coming next. The report from Public Health England into Black and minority ethnic deaths really draws attention to what is a national scandal, a way in which people from those backgrounds have been so much more at risk. And it's not fully understood, but it does appear that part of that is because the disadvantage that they've experienced living in this country and the jobs that they've been working in have put them more at risk. And this really is a real indictment of the inequalities in this country. But this was made worse by the government redacting and removing parts of the report from Public Health England. And then what we now hear is that it looks as though the inquiry that will be coming about as a result of that is to be chaired by someone who doesn't think that there's institutional racism in the country, when quite clearly there is. So here we've had this massive movement over the last 3 weeks for Black Lives Matter because of the murder of Floyd in the States. And it looks as though what's been happening in this country is paying lip service to that from the government, when it really needs to be taken seriously. I think what's sad about the way in which the Black Lives Matters protests have played out is, on the one hand, that having these protests with very large numbers of people on the streets is a concern in its own right from the point of view of viral spread. And if the epidemic comes back, then it's likely that many more Black and minority ethnic people will die from the coronavirus than have ever died as a result of police brutality. And that's a concern. But the other concern is that the way in which it then got turned into a story about statues and street names really was almost out of the Cummings playbook, because it has diverted attention from the real issue into a kind of cultural wars argument. And I'm afraid that's lost focus on what really needed to be followed through. Well, what we're seeing is a continuation of the global pandemic. It hasn't gone away. It's getting worse every day in terms of the new cases in different parts of the world. And we're seeing it increasing again in the southern hemisphere as they go into winter, which is the cold conditions which favour the virus to spread. So in the northern hemisphere, where we are, if the virus goes to sleep, if you will, during the next couple of months, it's still circulating, and it could circulate back round from the southern hemisphere as we move into autumn and winter. And what we really need to be doing is putting the lid on it properly through testing, tracing and isolating, so that if it does return anyway from other countries in the southern hemisphere later in the year, we would be in a position to clamp down on any outbreaks, because we'd know about them happening in real time and be able to detect them quickly and do the contact tracing and the isolating. At the moment, it just all seems incoherent and random and chaotic, and that the imperative seems to be about getting people back to work at any price. Now, I understand the economy has taken a terrific blow, and it's going to take years to recover from it. But the economy and public health are totally wrapped up in each other. They aren't separate matters. Public health is not a cost. Public health is an investment, and it's an investment in the economy. And if you don't invest in public health, then the economy may suffer much more if the epidemic comes back later in the year with a vengeance. So thanks for listening. If you've got questions, comments, please post them, and support Double Down News, Patreon. It's the future of news and broadcasting, digitally, online. These items are all about the truth. It's only the truth that matters.